Welcome to this week's episode of the Readout Loud, a weekly biotech podcast from Stat. I'm Adam Feuerstein.
And I'm Damian Garde. Our co-host Allison DeAngelis is out this week.
It's Thursday, September 7th, and here's what we're going to talk about this week.
It's back to school season in biotech. Two longtime analysts join us to talk about the state of the industry as it moves into the busy back third of the year.
We'll also discuss the latest news in life sciences, including a potential pivot at Biogen, new leadership at Illumina, and the future of CRISPR medicine.
All that after a word from our sponsor.
Hi, I'm Shirley Leung. I'm a columnist for the Boston Globe. I want to tell you about a new podcast that I'm hosting. It's called Say More. On Say More, I'll be talking to the doers and thinkers behind the biggest ideas of our time. How business works, how cities thrive, politics, technology, culture. I want to bring you inside those conversations. Say More, a new podcast from Boston Globe Opinion. Find it wherever you listen to podcasts.
So, Damian, welcome back from our short vacation last week. Allison is still on that vacation, so hi, Allison. Hope you're having a good time.
And not listening, frankly, but
Yeah, right. Yeah, hopefully
your mileage may vary with how you choose to spend your vacation.
So it was a little bit this week. Maybe everyone's getting a kind of a slow start to the fall, but it's a little short on news this week. But I thought it was really notable. Maybe some of the most notable news this week was a new executive appointment at Biogen.
Right. Yeah. So, zooming out or going back a little bit, Biogen had a sort of talismanic, venerated, and in some ways controversial head of science in the form of Al Sandrock, who left the company during the long and arduous Aduhelm saga, really like kind of at the nadir of it. Anyway, Biogen had not appointed a full-time replacement for Al for more than a year. And now here we are, and it finally happened. I think the person who replaces Al is Jane Grogan, a decorated researcher in her own right, most recently at smaller biotech companies, but known, I think, primarily for a more than decade-long career at Genentech. And what I think caught people's attention was not just her resume and it being impressive and her obviously being qualified for this, but that, Biogen had, by its own description, been a neuroscience-focused company. And Sandrock was a neuroscientist, but Grogan is not. Rather, her decoration comes from the worlds of immunology and oncology, and specifically the overlap between those two. And so the tea leaves one could arguably read is that Biogen, which, as we've discussed at length, is under new leadership in the form of Chris Viehbacher, its CEO, and a few other people that he's installed since coming aboard the company in November, might be pivoting a bit, or downplaying, at least, its longtime focus on neuroscience, which is interesting for the normal and obvious reasons, but also because I think the knock on Biogen for years, basically, was that they didn't do enough deals to diversify their high-risk pipeline, which was focused on things like Alzheimer's, the height of whose risk was, vividly illustrated by their experience there. And then the defense from within Biogen or from people who would be defending the company is, okay, we'll look back at the field of neuroscience, the biotech field of neuroscience for the past 6 or 7 years, and find a high dollar deal they should have done that wouldn't have looked bad in the long term, that wouldn't have been an overpay, if not an outright mistake, which I think was a fair conversation to have. And then there's this kind of third way that emerged, which was, well, why do you guys so focused on neuroscience? It's obviously very difficult. And so this is a really long-winded way of saying this one particular hiring, coupled with a few things I think that Viehbacher and others have said, suggests that the future Biogen might not look much like the one of the past 5 years.
Yeah, and if you look at Jane Grogan's background, I mean, she has scientific expertise in immunology and in immuno-oncology. Actually, while she worked at Genentech, the lab that she helped oversee actually discovered the TIGIT, or is it we're gonna do this again because we've gotten TIGIT or TIGIT, but that molecule, which has captivated many folks on the oncology side, she played a role in that. Now, I don't think that anyone will be too pleased if we learn that Biogen is going to sort of dive into the oncology world. I think people would be very pleased if like as you said, Damien, if they sort of diversify themselves away a little bit from neuroscience and get into immunology immunology, which has obviously become a very active field. And so I think in this appointment of Jane Grogan as the head of research at Biogen, I think we're seeing what Chris Viehbacher's vision for biotech. We're seeing that strategy put in place.
Well, for one, we received a very, in my opinion, compelling email. And as a recent convert to TIGIT, I have been swayed back to TIGIT, which is kind of phonetically more pleasing to say anyway. But one thing I was going to note about the whole like neuroscience, immunology, future of Biogen ideological debate, I remember, and I think that this was a non-background conversation, so I won't say this person's name, but doing reporting on Biogen years ago, talking to someone who had been there on the science side for quite some time. And this person's point was, this whole Biogen's a neuroscience company is kind of a fudged number in a way. Biogen hit it big in multiple sclerosis by doing immunology, by studying that disease, which is an autoimmune disease, but is in FDA terms and in market terms described as a neuroscientific indication. And Biogen perhaps mistakenly mistook its prowess in immunology for a specialization in neuroscience, which led it down this, Don Quixote quest in Alzheimer's disease. And so there's an argument to be made that this is less a pivot to neurology and rather maybe a more sober look in the mirror. That if there's a future immunology-focused Biogen, it will be less of a change and more of maybe a self-actualization. But I guess we'll see.
Shout out to Nick, who sent us this email with a very, very a good defense of the use of the term TIGIT. Sorry, I'm TIGIT. Nick was like, it's TIGIT. All right, so it's TIGIT for now until someone tells us otherwise. Shifting gears, Damien. We also heard this week the FDA has scheduled an advisory panel meeting on October 31st. Happy Halloween, everyone! For the Vertex CRISPR Therapeutics CRISPR-based treatment for sickle cell disease, and I think that's as we sort of look ahead to the fall and sort of pivotal moments for the biotech world. That advisory panel meeting on October 31st is one of those. It's going to be one of those very closely watched events.
Yeah, we're going to learn a lot. I mean, this is a program for which the supporting data that we've seen looks strong. I think it's widely accepted to win approval, and that approval would be a milestone by virtue of it being, a genome editing based medicine. But going back to, I don't know, however many years ago, felt like the ascent of gene therapy, moving from promising research, promising data to becoming a product, we learned a lot once the FDA got involved. They have, access to data that we don't see. They regulate not only safety and efficacy, but manufacturing. And I don't know, I think we've kind of been on a journey with gene therapy that has panned out maybe not exactly the way people assumed it would 5 or 6 years ago. I'm not saying that's going to happen for CRISPR per se, but as you say, this is a milestone because this is kind of it's almost like a rite of passage for a new technology to now go through, pass through the microscope of the FDA and the often quite unforgiving briefing document drop that precedes these meetings by a couple of days. So obviously there'll be more to come on that. I'm sure we'll be watching it. I think you'll probably be live covering it, if I'm not mistaken.
We'll probably that's probably when we'll live blog, I would imagine. That's going to be, again, I think, it'd be obviously closely followed within the sickle cell community. This is a potentially curative treatment, just for, from investors' perspective, just from biotech in general, again, first CRISPR-based medicine to sort of make its way through the FDA. So it will be a good day, and we will be covering it. The last bit of news this week, Damien, is the appointment of a new CEO at an embattled genetic sequence maker, Illumina. They named Jacob Thaysen as their new CEO.
Yeah, speaking of quixotic quests, Illumina has been on one of its own from the ill-fated and perhaps ill-considered multi-billion-dollar acquisition of the blood testing firm Grail, which set in motion a whole bunch of stuff, and Carl Icahn got involved, and most of the management team is gone, and there was a shakeup of the board, and Illumina had reached kind of a modern nadir. This is a company that was functionally monopolistic in the market for technology to do genome sequencing. That changed. They made strategic decisions, some of which didn't go well, leading us anyway to the appointment of a new CEO, a guy named Jacob Thaysen, as you mentioned, who comes to the company from, it's either Agilent or Agilent. I look forward to another email explaining to me how to pronounce that company. is that the company's name rather, which is another life sciences tools firm. And so obviously he's experienced in the, relatively unsexy market for like picks and shovels for how the business of the life sciences is done, both in industry and in academia. And, the stock price fell upon his announcement. And I saw notes from analysts saying there was an expectation of perhaps a higher profile name. I don't know what that would be. It feels like there's perhaps a little bit of magical thinking. I know there was a notion that perhaps Jay Flatley, the former CEO of Illumina, who really led it through that dominant period that it had, might make his triumphant return, which I think the magical thinking was both one, that he would do that, which there was no indication that he was interested in doing so. He's kind of writing out the back end of his career as kind of an emeritus. But then the magical thinking that his reappearance would somehow bring back the good old days when the market that Illumina was once so hegemonic in has changed. They have legitimate competition coming from, in some cases, companies that they once tried to acquire. And that's not going to just be reversed. Like Illumina is entering kind of a brave new world in so many ways. And they very much have their work cut out for them after the downswing that occurred over the past few years. And I think, it's something to watch. I think reading sort of investor reactions, there is a hope for maybe at least a return to normalcy. I think Illumina has been cursed by being a little too interesting in recent years, and a company like that is supposed to just like deliver top and bottom line revenue growth and keep it moving. So we'll see if that actually pans out.
The passing of Labor Day marks the canonical end of summer, and in biotech, that means the late year sprint of medical conferences, investor meetings, and earnings calls is kicking off in earnest.
We wanted to have a sort of back-to-school conversation as biotech moves into the busy final third of the year, and who better to join us than a pair of analysts who have been doing this for quite a long time. Respectfully, we've got Josh Schimmer and Eric Schmidt, two well-traveled sell-siders who have just joined Cantor Fitzgerald to cover the industry. Josh and Eric, welcome to the podcast.
Yeah, thanks for having us.
Thanks, guys. Great to be here.
So, Josh, Eric, we don't want to bury the lead here news-wise, but yeah, this week you guys both have joined Cantor Fitzgerald, their biotech healthcare research team. Tell us about this new. I hate the word journey. I'm not going to use the word journey. Tell us about this new job that you guys have.
I mean, I hope it's a journey. I think it's going to be a terrific journey, Adam. I mean, anytime you get the opportunity to learn about biotech stocks and write about biotech stocks and talk about biotech stocks, as we all know on this call it's a privilege, right? And in particular, the platform and opportunity at Cantor that is going to, be more than big enough for Josh and myself and the others who are already here on site writing on these companies. This is in many ways a dream come true. I mean, there aren't too many banks in a market environment like this one that are really willing to put their foot forward and lean into, what's obviously a pretty bearish tape and build and create. This is really a wonderful opportunity. As you probably remember, Adam, Josh and I did get the opportunity to work together many, many years ago, and to be reunited with him is also a dream come true.
Yeah, and ever since I left Eric's team many years ago, I've always been trying to find ways to work together again. We worked together incredibly well back in the day, and we've stayed close friends ever since. And Eric is obviously, I'd say the most respected sell-side analyst on the street for his stock savviness and, his intellect and his just general disposition. He knows how to build great teams. I've always tried to emulate that, wherever I've been, and the opportunity to do this with Eric and to leverage the folks that are at Cantor. And I think many folks don't necessarily know who's there, and many folks don't necessarily appreciate the talent that's already there across the platform. And our goal, hope, and job is to try to elevate as best we can the research franchise and more broadly the whole firm, given all the experience we've picked up over the years. I don't know anyone who's born with an innate ability to do biotech except for maybe Eric. he just seemed to know it, but the rest of us just pick up best practices along the way. And I've been so fortunate to work with some of the best in the business, is, names that everyone really knows. And, that's how you build your own toolkit, and then ultimately become a teacher. And, as you guys both know, this biotech universe has changed dramatically over the last 4 or 5 years. It's almost unrecognizable. And it needs a new approach. It really needs a very different, integrated approach, one that both Eric and I know really espouse. And just this is like day 2 for me at Cantor, but it's already clear that the platform is eager to embrace this approach as well. So we've got a lot of work ahead. I think we're going to be able to make a big impact. And that doesn't mean just us having a big impact. It means the team really starting to come together and produce the kind of research that investors and companies really not just want to read, but hopefully feel like they need to read.
Well, and we want to get to the bearish tape, Eric, that you mentioned earlier, but kind of on that point, Josh, I was curious, maybe on sort of like an inside baseball tip, like I think a lot of people externally don't totally understand what sell-side analysts do, and I was curious both in terms of, what the nitty-gritty is of the actual job, but also how it's evolved. You've both been doing this for a while, how the expectations and the demands of the market of investors have changed, and how like the investor base has changed as biotech has evolved all at the same time. It seems like you guys are tasked with keeping a lot of plates spinning. And so I was just curious, in 2023, as you're kind of marking this new territory and setting out on this new, the only word I could think of was journey, so we're just committing sins in Adam's mind. I don't know, how has the landscape changed as you embark on this one?
Wow, it's a great question, and as you know, it's ever changing, ever expanding. Well, there have been some moments of contraction, but that temporarily slows down, but it doesn't stop the industry. It's getting more complex. It's getting more competitive. You need more domain knowledge and domain expertise, but that alone isn't enough, because how many companies are in multiple different therapeutic categories? There are finite degrees of separation for the entire biotech universe as well, that it's like this tangled web. And one of the challenges that we've been wrestling with is where do you even start? Where do you begin? And that we have some frameworks that we'll be deploying to kind of at least give us some direction. But the answer is there's no start and there's no stop, right? In this industry, it is literally a universe. And at the end of the day, though, we're here. Our core principle is to try as best as we can to ensure that capital flows to the companies that really are doing the best, the highest quality innovation, right? That investors are thinking about where the best returns on their investment dollars are going to be, which generally should follow who's adding the most value to the patients. And it really is trickier than ever. The therapeutic categories are getting more crowded than ever, so it's harder to try to pick winners, if there even are winners. But I think what has been happening perhaps over the last 6 to 12 months, say, is that some of the chaos of innovation, that the bubble of biotech that we saw over the past few years has started to find a little bit of order, right? I think we're starting to realize that you don't need 20 of the same thing. And there's one thing that I know is that we're going to have fun. Because this is a fun industry. It's an exciting industry. There are setbacks, of course, and there are unfortunate instances of side effects and even fatalities that are caused by drugs. But overall, if you look at the positive impact on health outcomes that this industry is generating, how can you not be excited about it? How can you not have fun along the way?
Hey, Eric, I got a question for you, because you've been doing this a really long time. So you've seen a lot of innovation, a lot of scientific discoveries get translated into drugs. Has it been harder for investors to grapple the science, to understand the science, and therefore then invest in it?
Adam, I honestly don't think so. And thanks for saying I've been at it a long time. I'm going to take that as
you and I both, Eric.
I'll take it as a complimentary way of saying we're both a little bit on the elderly side. But it's been a wonderful opportunity to watch the history, the transformation, the growth of the industry that Josh just alluded to. And he's right. It's a frenetic, large, faster paced, more content, more competitive industry than it's ever been. And we have to deal with that as either analysts or reporters and opiners on this industry. But one thing that really hasn't changed is that our job in the investment community is to find, as one of my mentors in research told me, correct non-consensus conclusions, right? If you can come up with a correct conclusion and it's not already widely known, you're going to be able to make money. So our clients are craving that insight and analysis that helps them get to an accurate view of a company or a drug or a stock, and allows them to be differentiated from the pack. And that's really, as an analyst, what we set our sights on many, many years ago, and what we continue to really set our sights on today. It's a lot of separating the wheat from the chaff, for sure. But if you can even come up with a couple of correct non-consensus conclusions on a yearly or quarterly basis, you're going to be a good analyst.
That said, I think that, Adam, to your point about the complexity making it harder, for me, wow, without a doubt, it's so hard to stay abreast of all the relevant information, even all the relevant programs. And, from time to time, I think we all get blindsided by a program we just weren't paying attention to. Maybe we didn't even know it existed. And it comes along, and now it's a competitive threat to, another company that maybe we had been excited about. These are new dynamics back, from I know when I'd say we started in the industry, but when I started or got a significant head start, it was so simple. It was much more orderly. There wasn't as much complexity. You didn't need to contemplate one therapeutic category having a long-acting injectable and an oral and maybe even a gene therapy. You were lucky enough to have a new therapy for a high unmet medical need. That was hard enough. Trying to figure out the value of a new emerging orphan drug product with absolutely no competition on the horizon. Now we gotta battle through that complexity, the competitive dynamics. And I think one thing that Eric and I are going to bring that I know we both love, and many platforms don't embrace, is active and rigorous, friendly debate. Just fully respecting each other's opinions. Trying to fight for being right and recognizing that we're both going to be right, we're both going to be wrong. And at the end of really what we're striving for is accuracy as best we can.
Well, maybe this could be a topic for debate, but biotech obviously is down, as we alluded to. The tape is bearish. I think it's the XBI is down something like 3% for the year, maybe 6% in the trailing 12 months. All the numbers are generally red. And, Josh, as you mentioned, there was a bubble that existed that no longer does. But I'm curious, in this moment, do you think that this is settled into like a corrective new normal, or that this is still, crawling out of that bubble and the new normal is something greater? Like the number of IPOs this year is something like 6. I imagine that's not how you think it might go in 2024. But when you're advising investors or even just kind of catching up and establishing your framework for the industry in this moment, where are we on the boom and bust cycle with the boom firmly in the rear view?
Yeah, well, thanks for highlighting the catching up component. I've been away out of the game for 2 months. That's like an entire year in biotech years, right? And that means Eric's been away from the sell side for about 40 years. So go easy on him. Yeah, you highlight the IPO window. You highlight the market tape in general. Obviously, but there have been some companies that have had great performance. And that's always the name of the game in biotech is to find those. It's always going to be that kind of a stock picker's market. And the reality is when the biotech tape itself is flat, it can often be the best stock pickers market, right? When everything's going up together, how do you pick stocks? When everything's going down together, how do you pick stocks? And then when everything goes flat or drifts down a little bit, we lament that the sector's not going up again, as though we want that whole group trade to happen. But it's that group trade that makes the stock picking really difficult for clients and investors. So, that's one point that I would make. So, what I see personally in the industry is a healthy looking industry. It's not supposed to all work. We still have cleanup to do from those, 5 chaotic years of we IPO'd enough companies in 5 years, probably the last 15 or 20. But to me, what the exciting thing is that if you do look upstream, right now that biotech window's open a peep. But in time, one would expect there's some wonderful private companies, just wonderful private companies that are picking up momentum, and ultimately planning for their own IPO someday. So, I think the record year of IPOs, I think correct me if I'm wrong, if like 2021, I track like 100 plus IPOs that year. And, I don't think anyone necessarily wants to go back to 100 plus IPOs, certainly not the 100 plus IPOs we did that year, right? Because there are a lot of lower quality names in that group. But when I look at the private world, if we open the floodgates for IPOs, we could IPO 100 high quality companies.
That's a lot of IPOs, Josh.
Well, presumably they'll be spread out over a few years.
We better have 100 companies, existing companies, delisting themselves.
It's a great point, right? Because is the scale and the scope of the biotech industry itself, is that a rate limiting step? Does the industry need at a maximum of, say, 500, 100 million plus market cap companies? Like, is there certainly one's own ability to digest this industry, is clearly finite, right? And personally, I love it when it's around 400. 450, because I think to me that's like, you can kind of get a sampling of everything, you can quickly filter and screen and look through, but that's just me. And at the end of the day, like, honestly, none of us should be doing this job. AI programs should be doing it for us, and we'll be able to manage far more than we can.
Well, one of the, I guess, if we sort of started to do a review of 2023 already. So one of the things that we've seen this year, so already 2023, a lot of is, restructuring. We've seen companies, unfortunately, have to lay off employees and maybe cut back on programs, change direction. We've seen companies, merge into other companies. Do you guys think that's healthy, sort of a consolidation of the industry? Is that healthy for biotech in the long run?
I do think consolidation was necessary, Adam. As Josh was referencing, the industry just wasn't ready for this multi-hundred new influx of companies over the 2028 to 2020 or 2021 timeframe. We didn't create, hundreds of new qualified CFOs or hundreds of new qualified general counsels or CEOs or heads of R&D over that period. So, there's no reason to think that, we could have created that many, hundreds of new high quality enterprises that, had a reason to exist, a full scale developmental capability, capable of moving forward new drugs, right? So I think it was a bubble. Unfortunately, we learned over that period of time, 2028 to 2021, that there are no brakes on the system. There are no gates or controls. Bankers, analysts, buy-siders, you name it, nobody is capable of limiting the influx of companies in a bull market. And, that's nothing new. Adam, you and I have seen that before. This industry, unfortunately, is susceptible to those big cycle movements upward and downward. We're going to see it again. I'm sure of it. I don't know when. I think Josh is right. Today's market environment is a great one for stock picking. It's one where, generally speaking, good news is rewarded and bad news isn't. But it's not always going to be that way. There are going to be these momentous swings of capital in and out of the industry. that really, more than anything, drive the sector up and downward. So it's just probably a phenomenon of science, as you were kind of alluding to very earlier on the call. New science not really being open and interpretable to so many investment professionals, and the industry being judged on things that are subjective as opposed to objective financial metrics like cash flow and earnings, right?
So kind of on that point, I'm curious, and you alluded to this, what do you think the rate limiting factor is? Is it the ability to discover new cool things that can make new medicines, or is it the availability of talent to actually interrogate those and properly progress them? It kind of sounds like you think it's the latter. There's a finite number of people who can take a cool idea and turn it into an enterprise versus the less finite number, apparently, of people willing to put millions of dollars into random enterprises.
Yeah, I think it's multifactorial, Damien. I do think, capital matters. And if you have access to capital, you can hire and train and begin to cultivate good talent. But I do think, having spent some years on the operational side, that people and execution are really, really important and sometimes probably underappreciated on Wall Street.
Eric, we alluded to this, but you obviously are joining Cantor and returning to the sell side after spending some years at Allogene as its CFO. And I wonder if that experience, has that given you any lessons about sort of how to do this job, the sell side job again?
Yeah, great question, Adam. I certainly hope I'm older and wiser and more experienced. I know I'm not younger and better looking and more energetic. So, hopefully I can pull a few tricks out of the bag here. I do think there are some things that, you learn on the company side. You learn to probably pay really, really close attention to, for example, SEC filings and anything that has to be vetted by lawyers. If you're even reading press releases or corporate decks, that every word in any such document has been reviewed by 5 or 6 people, most likely, and both what's in those documents and what's not in those documents can be interpreted very, very closely, and maybe can, provide some clues to where reality is with regard to a specific story. So that's just one example, but as we go forward as a team here, we'll hope to rely a little bit on that expertise.
Well, Josh, Eric, thank you for taking the time to join us today.
Thanks so much for having us.
Really a pleasure.
That does it for another episode of the Readout Loud.
Thank you to Teresa Gaffney for producing this week's episode.
Our senior producers are Hyacinth Napanato and Alyssa Ambrose. Our executive producer is Rick Burke, and our theme music is by Brian Joel.
And we'd love to hear from you. Tell us what you like about this week's episode, what you didn't like, and which other words we are unwittingly mispronouncing. You can do all of that by sending us an email to readoutloud@statnews.com.
And if you like what we do, leave a review or a rating on Apple Podcasts or whichever platform you use to get your podcasts.
See you next week.
Here we go. Take 3. Take 3. See, Allison's not here. We can't do this. Here we go.